Oxygenation, assimilation, elimination, the three zones. Okay, welcome back. Let's start now. Now, we're going to take a look at the human body, and we're going to divide it into three zones, the three main zones, which are also the easiest to identify. As you can see from the diagram in front of you, we're going to identify first the oxygenation area, then the assimilation area, and finally the elimination area. In this part of the video, I suggest that you don't go immediately to work on the person and put everything into practice. Look first at this theoretical section, and this will help you to understand the whole video course. Then you can always go back to the video and you'll notice that everything will come automatically. Then you can arm yourself with the magic markers and work directly on the person. Now, what are these three zones? The oxygenation zone is marked by that dotted line that goes from the left armpit area to the right armpit area. You see the first dotted line at the top. Now, from that dotted line upwards, that whole body part corresponds to the nerve supply to the lungs and to the heart. Now, if a person, for example, feels very tense in that area, the nerve supply to the lungs and consequently to the heart will be affected. And this could lead to certain problems. Now, here and also in the next videos where I'll explore this further and I will look also at specific cases, I tell you to work on the oxygenation area. You will go and work on this area. So it's very simple. The oxygenation zone comprises all the nerve supply that branch off from here and go to the heart and lungs. These have the function of oxygenating the blood. Immediately underneath that, we have the assimilation zone. As you can see from the dotted lines, to identify this, it's quite easy. You just need to draw a dotted line, even an imaginary dotted line, from elbow to elbow. And then everything that falls between that dotted line and the dotted line from armpit to armpit, you have the assimilation area or zone. So here you will find all the organs in charge of assimilation, so assimilating food. So we'll have the liver and so on. In the stomach. Then you'll notice that many people have given problems in this area, in this zone. So the assimilation of what they eat is altered. The last zone, but not least, is the elimination zone. We'll always be taking as reference the dotted line from elbow to elbow. That's where the elimination zone starts. And it will comprise also the gluteus. In that specific area, we will find the nerve supply to the intestines, for which have to eliminate the feces. We will have the bladder to eliminate urine. We will have the uterus in women to eliminate the cycle. So everything that the body needs to eliminate in terms of nerve supply is present in this zone. Now, when I will tell you to go work on that given person in the elimination area, you will know exactly where to work. And you will not confuse it with the assimilation area zone. Now, I suggest that given that you have the possibility to print these diagrams, print them, put them in a notebook or hang them up somewhere, and until you become very familiar with these diagrams, you can just keep them as reference. If you have them in front of you, everything will be much easier. Okay, let's start. We have to identify the oxygenation area, the assimilation area, and the elimination zone. So, start from the armpit area with your magic marker, and then you draw a dotted line to the other armpit. Then you take the two elbows, and you can also draw a third dotted line at the height of the top of the natal cleft. So you draw a dotted line. So everything above that dotted line is the oxygenation zone. Then we take the elbows as reference, which obviously need to be positioned correctly. If they're too in the wrong position, you will not have identified the right spot. So you draw a dotted line from elbow to elbow, and there we have the assimilation zone, which is the central zone. And then you can draw a dotted line at the top of the natal cleft. Okay, so now we have marked the elimination zone. The gluteus, on the other hand, will be the genital reflex zone, but we're going to look at that later. Now, as you can see here, we have the oxygenation zone, assimilation, and elimination zones. I know I'm starting to repeat myself, but I want you to become excellent at this. This is another image of my beautiful model, and this is a top view. Okay, now we're going to explore the details of the technique. I'm going to show you how to massage these body parts. Now, I'm giving you, these are slow motion pictures. You will have to pull the skin away from the body and pinch it. I will also show you the images in normal speed. So you start from the spinal cord, you pinch the skin. As you can see, I'm pulling it away from the underlying tissue. Once you have pinched it, you will have a roll of skin between your fingers. You have to roll it between your fingers, moving from the spinal cord in an outward movement. If you want, you can jot down this exact point in the video, because this is a crucial part of the entire video course, and you can always go back to it. And I want you to learn both the technique and the results of this technique. As you can see, I'm rolling the skin. This technique in the technical terminology is called palpé roulé. So you start from the spinal cord, you pinch the skin, and then you roll it. What happens here? The underlying nerve supply, by stimulating this nerve supply, you are working by reflex on the organs. So when I was saying, when I was talking about the word, when I mentioned the word tension, this tension will be alleviated through this technique. I'm now going to show you a blow up. You see, this is the spinal cord. When you pinch the skin, you have to start from the spinal cord, from the side of the spinal cord. So you pinch the skin, starting from the spinal cord, and then you roll it. You roll this roll of skin all the way down in an outward movement. And you do this for both sides. So when you need to work on the other side, you will have to change your position. You will go to the other side of the customer, and you do exactly the same thing, always rolling in an outward movement. So you alleviate the tension by doing so. All the way down. You see, I don't stop halfway. Now I'll show you how to grab the skin. I'm going into the details, but in fact, to do this is quite simple. So you take the roll of skin, you pinch it, and then slowly, without letting it slip through your fingers, you roll it all the way down. You can also use a little bit of oil, but not too much, or it'll be too slippery. In the beginning, you can also use no oil at all, or just a drop. Then you roll it all the way down. Try not to press too much, because this can be, if there is tension underneath, it will be very painful. So, as I was saying in the reflexology video, you have to try to tame the pain. So you pinch the skin, and then you roll it between your fingers without ever letting go, all the way down in an outward movement. We're still in the oxygenation area, by the way. So I am now alleviating the oxygenation area on the right side of the customer. This part of the video, we're in the oxygenation area. Now, this is the real speed of performance. This is the real speed, and I'm going pretty slowly. This is not a technique that should be performed quickly. In the beginning, this roll of skin will probably tend to slip through your fingers, but then you'll see that with time everything will come automatically. Once you've finished on the one side, then you have to move to the other side. You see, I've changed position. Now I'm on the right side of the patient. Before I was on the left. I take the other half. Now I'm working on the other half of the skin. So I pinch the skin from the spinal cord and I stretch the skin in an outward movement. It's like combing hair that has curled up. So as you comb, as you go through this passage, you will notice that the patient will suffer a little bit, will be in pain. But the important thing is you don't stop halfway. Don't do that. You're my pupil and I want you to do it perfectly. Once you have stimulated the oxygenation area, then we can move on to the assimilation zone, the zone that I'm showing you here. So I take the skin, I pinch it, and I roll it all the way down. I take it, I pinch it, and without ever letting go, I roll all the way down. It's easy. It's not impossible at all. You see, right now I'm working on the left side of the customer. If I have to work on the right side, then I have to change position. So I have to go to the opposite side. Now I have to work on the other side of the back. So we're always in the assimilation zone. I started from the armpit area, and then I roll the skin all the way down. Now, on a tangent, this model has a very, very elastic nervous system, so there is really no tension in her body, and so it's very easy to pull her skin away from the body. You can see how easy I'm doing that. In some people, though, this will not be so easy. So I'm going to show you another technique that will help you to get the same results, where the skin is not so easy to pull away from the body, from the underlying tissue. Now I'm going to focus on the elimination zone. So we start on one side first, and we start to pull the skin away from the body, and then roll it down. I'm starting to repeat myself, but that's just because this technique is very simple. You start from the spinal cord and you pull the skin away from the body and roll it all the way down. Don't stop halfway. You do one side first and then you do the other. You always work on both sides, the left side and the right side. Once you've completed one side, you move to the other, so you change position, and then you perform this palpé roulé technique. Consider that in the lumbar region, well, this is the elimination zone, okay, but it's also the lumbar region. The skin sticks to the body more than it did in the other zones, but you'll notice that with some patients, everything will come automatically. Okay, this is a wonderful image. To do this, I had to ask my cameraman to climb up on the cot with a whole camera, but it was worth it because I can show you how this is done. So you start from the spinal cord and you roll all the way down. I'm in the assimilation zone right now. I shot this just to show you how to roll the skin. You start from the spinal cord and you roll all the way down. I'm working on the right side of my model. When I pinch the skin, notice that I start from the spinal cord. I don't start from the left side of the spinal cord. So you see, I don't do that. Don't do that. Start from here and then you roll down. You start from the spinal cord. Don't make the mistake of starting from the left side of the spinal cord to massage the right side of the body. Here we have the lumbar region. So I'm going to pull the skin away from the body and roll down. As I was saying before, in the lumbar region, the skin will always be more tense. And so the skin will stick to the body even more. But with some patients, you just roll the skin down. So the roll of skin here is going to be bigger because the skin is thicker as opposed to the oxygenation zone, for example. Okay, perfect. So far we shouldn't have big problems. Now, in summary, you have learned so far to perform the palpebral technique in the three main zones of the body. So these are not metameres, they're zones. In the next video, we will talk about metameres. So you've learned to perform the palpebral in the oxygenation area. So every time a customer comes to you with problems with the lungs, problems with the heart, you will work on this. You will use this technique on the oxygenation area. Always remember to start from the spinal cord and then to move, to roll the skin in an outward movement and to do on both sides. Then I have shown you the assimilation zone. Work always on both sides. And this is good to work on this for any problems related to the stomach, the liver, all the organs that are responsible for absorbing what we eat and what we drink. The elimination zone, now this picture in front of you, there is a dotted line missing. The dotted line above or at the top of the natal cleft where you see the writing eliminazione. I haven't drawn it, but in the video it's there. Okay, so this is the elimination zone. We will work on this part of the body and pulling the skin away as in the palpebral technique in cases of problems with elimination, so problems with the intestines, the kidneys. But don't worry, I'm going to explore this further in the next video as problem by problem. So you'll learn to do all this very soon. In this video, I wanted to teach you the technique, how to pull the skin away from the body and how you roll it, holding it between your fingers. In the beginning, you will probably slip through your fingers. It will be difficult. Some people will be in extreme pain. Other people won't feel anything, and their skin will look like cat skin. You take it and it comes up like no problem. Over time, however, you will become better at this. You will become more sensitive, and this will allow you to work with all sorts of patients. Both with people who are very painful and those who don't feel anything at all. This technique that I've taught you so far, working on these three zones, it is essential, it is fundamentally important for alleviating back problems. When you have a backache, for example, the underlying nerve supply, which is what we're working on right now, it tenses up. like elastic bands, they stretch. The example I give my patients often is, think of your body as a foot that is stuck in a very tight shoe. And as a consequence, the foot hurts. The same thing applies to your back. If these nerves are too tense, then you're going to have to start having problems. Now, by using this technique, this palpé relay technique, in the beginning, it will be a little painful. So be careful, may always measure out your strength, because the person comes to you for a massage, and try to explain to them the reasons why it may be painful. The person will be happier to come back. If you don't explain it to them, then, the day after they'll feel all with pain all over, and they'll start to wonder what you've done to them. So when you find a person with a backache in the oxygenation, assimilation, or elimination zones, you will notice that through this technique, you will obtain excellent results. Some people go to the expert physician to solve problems, who knows where, whereas most of the time, these problems are only caused by a strong tension in these nerve supplies that I've shown you, which through this technique you can easily solve. Okay, very good. Let's move on.